So what I'm trying to do here is give you another diagnostic tool belt, another tool for your tool belt. So you can kind of look at the cues from your patient and decide, what element they might belong to, and how to what formulas and what acupuncture points you could consider using. Now, when we come to the treatment of each of the phases, I'm not going to spend a lot of time on treatment because it's all written there. Well, I think it's more important that we talk more about the presentation of the person. Okay, so let's get started. Okay, so what we'll go through in the next couple of days is, first of all, I'll talk a little bit about Dr. Hammer's background, my background, and one of my contemporaries, Brant Stickley, his background, because he was foundational in sort of putting the model of Dr. Hammer's on top of sort of Shan Han Lun and sort of six confirmation theory, which makes the application of Chinese herbal formulas, and acupuncture, very seamless. To start up with, we're going to talk about the main concepts of Dr. Hammer's model, but also I'm going to talk a lot about one of them. Like, I spent 30 years with Dr. Hammer, and one of the, probably being around him that long, the most important thing I learned was how to deal with people, how to form a relationship with people, with your patients. And that's probably been the most useful information, and it has progressed me as a practitioner. And a lot of that, I don't know if Georgina has this book, but the patient-practitioner relationship in acupuncture, every person who's treating people should read it. It's a very, very good book, and it will help you. It will help you understand managing people. Okay, so we'll then talk about the 5 phases in the evolution of being and becoming, and we'll talk about the water, wood, fire, earth and metal, and we'll talk about bonds and how central bonding is to us as humans. This morning we'll talk about the phenomenology of the 6 channels and the open-close pivot and the Biao Ben Zhongqi of each of the 6 channels. And then we'll talk about the integration of the models, how you can kind of sit one on top of the other. And then we'll discuss each of the phases in the evolution of being. And we'll talk about the personalities, the restorative maneuvers, and just ideas for treatment. And then last up, I'll present a couple of cases out of my clinic. Now, the other thing to be said about this is when we're talking about the personalities, what is presented here is the extreme. And, you're not going to see what we talk about here come into your clinic. You're going to, you never see the textbook, right? So it's going to be some people with that sort of tendency. But it's being able to pick up on that allows you, or gives you ideas for treatment, diagnosis and treatment. Okay, so Dr. Hammer, he was born in 1924, and he served in the Air Force during World War II. And this is where he started becoming interested in people, and predominantly he used to talk about, it fascinated him, the reaction of people under stress and how different that response could be. And he was like, we were all had the same training, we all were under the same circumstances, but the reaction to everybody was very, very different. So when he got back from the war, he attended Cornell University and Medical College, and then he went on into psychiatry and psychoanalysis. And he practiced psychiatry and psychoanalysis predominantly in children and He was also worked in a university setting. He also worked with drug rehab, and he became interested in body work. So he was one of the first people who started crossing over psychoanalysis with sort of body methods, body work. In 1971, he met John Van Buren, and he's the guy who was influential in setting up the schools here in Australia. So when I started studying with Dr. Hammer, a lot of his training in Chinese medicine was very similar to mine, because we'd kind of come from the same source, I guess. And then he met Dr. Shen, who escaped the Cultural Revolution in China, and he brought with him a pulse system and knowledge of the Meng He Ding lineage. So Dr. Hammer worked with him, learnt the pulse method, and they spent 27 years together where he documented the pulse system of Dr. Shen. And over this time, he developed his model of ontological psychology. And he based that growing from a single cell into a mature adult and then sort of declining again and all the way to death. He associated the Western psychological stages on top of the 5 phases. So it's very interesting, and sort of it's I think not many people are aware of it, but it's a fascinating body of work. Okay, so my history is I've been practicing for 29 years. I was in the United States for 15 of those, and that's where I met Dr. Hammer and started with pulse diagnosis, studying with him, and then he was in Florida, I was in New York. I met him in New York, but I would travel down to Florida frequently and study pulse, and then through all that training, we got the dragon risers, redbird flies. So I've done a PhD looking at the reliability of the pulse method, and I practice in Sydney, and I'm trying desperately to raise the level of Chinese medicine practice and get people interested in the methods that are hard to learn, which is surprisingly difficult. But I think once people are confronted with threats like AI, it will make them want to improve themselves. So Brant Stickley is one of my contemporaries who studied with Dr. Hammer for a similar amount of time. So he's been working from about 2010 at the NUNM, so it's the National University of Natural Medicine in Portland, Oregon, and he's in the School of Classical Chinese Medicine, and he's been teaching there and studying under Heine Fruhauf for that time. So his focus has been on Neijing, Shanhan Lun, and Jingui Yuale, and his main focus with this work has been putting the 5 phases model of Dr. Hammer onto the theory of the Neijing and the 6 conformations, so that you can apply formulas based on Dr. Hammer's model. Okay, so that's the people involved. Now, let's just start at the beginning.